Toward a Cancer-Free World, presented by 10 TV and The James.
Encouraging news when it comes to cervical cancer survival, thanks to screening, continued research, and new treatments.
Cervical cancer is the most common malignancy worldwide, but fortunately in the United States, it's much less common. There's about 10,000 cases of cervical cancer diagnosed in the United States per year. It's a cancer of the opening of the uterus or the cervix that's typically sampled with a pap smear. Given the fact that pap smears are more widely used today, the rate of cervical cancer has dropped precipitously.
And who's at greatest risk?
The greatest risk for cervical cancer are women who haven't had a pap smear in the last 10 years. At this point in time, it's recommended that a woman get a pap smear between every 1 and 3 years, depending upon her current situation at that point in time. Most women with cervical cancer are picked up early so that the survival rate is very high. Once the cancer begins spreading, the survival rate drops quite a lot. So it's really critical for a patient or a woman to see her gynecologist or primary care doctor for a pap smear.
Is there new research on cervical cancer treatment that's improving survival?
There's recent data from a clinical trial that demonstrated that the addition of a chemotherapy called bevacizumab or Avastin improves the chance of survival of cervical cancer once it has spread. And that's one of the first times that we've seen this in women with this disease in a long time.
You can learn more at 10tv.com/towardacancerfree world or by calling the James line.